Okay, good afternoon, everyone. We want to thank you for joining us and also welcome you here today. I'm going to get up our presentation to share with you. We want to welcome you to joining Dignity Health Global Education today to talk about the Equity Impact Scholarship. It is my privilege to welcome you as well as thank you for all that you do. And I also want to take this time to also welcome our special guests. So we have with us today two very important and special guests joining us, both Katie Boston Leary as well as Danielle McCamey are with us, and we can't thank them enough, not only for what they do in all of healthcare, but also for being change agents and trailblazers in the field of healthcare. So thank you both for being with us today to talk about not only why this Equity Impact Scholarship is important, but more importantly, why we must continue working together to promote inclusion, diversity, and equity in all aspects of our healthcare system. And I also want to acknowledge and thank my colleague, Nayla, for being with us as well. She is a phenomenal leader at our organization and without question has had an integral role in the work of this scholarship. So again, thank you to all of you that are joining us. Thanks to our panelists for being here. And just want to start with a little bit about the scholarship, and we'll be talking a little bit further about it as we go through this discussion today. I do want to encourage you to be thinking questions. At any time, post questions in. We will be happy to address them throughout. And we want to encourage you certainly to bring questions forward, because we are here not only to share this scholarship with you, but also to have an important conversation on diversity, equity, and inclusion. So the Equity Impact Scholarship was developed by Common Spirit Health, and we can't thank Common Spirit for acknowledging and recognizing at the very top of the organization why diversity, equity, and inclusion is so important in our healthcare system. I can tell you as a former hospital administrator that had the privilege of working not as a clinical individual, but as a non-clinical leader, that when we looked at our, not just our nursing workforce, but all aspects of our healthcare system, we always did best when we had the opportunity to work and thrive in a diverse culture within the workplace. And we all know that having more diversity, equity, and inclusion leads to a better experience for our patients, most importantly. So Kathy Sanford, Chief Nursing Officer, and Marvin O'Quinn, President and CEO of Common Spirit, have both shared with us in these quotes why it is so important that Common Spirit made this decision to create this $3 million Equity Impact Scholarship. And it is, we can't thank them enough for not only recognizing it, but taking the action, which oftentimes is not always the case in these types of situations. And this is an important movement and opportunity to impact all of our healthcare system. And we thank them for their leadership and their inspiration in making it happen. I just want to highlight the fact that what we are here today to talk about is truly to envision a healthcare system that is more equitable. And in order to do that, we've also got to think about how we create our educational system also to be more equitable. And that's what the Equity Impact Scholarship Fund is truly all about. We want to recognize that we have phenomenal healthcare leaders today, and we've got to create phenomenal healthcare leaders of tomorrow. And we believe strongly that in order to do that, we must be willing and truly embrace bringing more individuals that represent diversity, equity, and inclusion into our healthcare system at all levels, so that we can have future leaders that look like the patients that they serve. We can have providers and clinicians that look like the patients that they serve, and so on. So this is all about what the Equity Impact Scholarship is about. It is also about making sure that we bring skills-based education that is transformational to the system, and that we think of this at all levels of an individual's journey into healthcare, whether it's allied health to nursing, whether it's respiratory therapy, wherever they come from within their healthcare experience. Everyone can benefit from skills-based approaches that build from one another to another. And then also the importance of an experiential learning platform that not only brings learners together, but celebrates them for who they are and embraces them for what they bring to the healthcare environment. And so again, we thank you, and I'm going to pass it off to Nayla.
Thank you, Jeffrey. Through the scholarship program, we would also like to give access to all, access to world-class education that we've developed in partnership with top-tier universities out of United States. And over the next couple of slides, I will walk you guys through the process on how to apply for this scholarship, as well as which programs are eligible for the scholarship, and what your options could be to take your next certificate, your next bachelor's or master's with Dignity Health Global Education. The scholarship program is a $3 million fund, which is applicable across 11 programs consisting of consisting of degrees and certificates. All of our programs are offered entirely online. They're done asynchronously, meaning that students can study at their own time, whether it's really early on a Monday morning or late on a Sunday night. It's basically done at your own time as long as you follow the timeline of the course. The scholarship is applicable to all students, regardless of their location, the United States and internationally, only for the certificate programs. I will be able to dive deeper into this as we go through the application process. But for all international applicants, we've only opened the certificate programs, whereas all students based in United States can apply towards all of the programs that qualify under the scholarship. The enrollment period has already started. It started back in July and it's running up to April next year for all the intakes that we have lined up, which is in November for some certificates. In January, we're starting all of our programs, certificates and degrees. So you still have a chance to apply. And then our next intake for the certificates would be the following month, February, March, and so forth. The deadlines at the moment are not set. As I just mentioned, the application cycle is still open, so you're more than welcome to apply towards any of the programs that qualify under the scholarship program. The scholarship amounts range from $1,500 up to $35,000, varying on the program that you'll be applying for. As you go through our scholarship program, you will also notice something that we're calling zero out-of-pocket cost. That means that a combination of the scholarship with your employer tuition reimbursement program and any grant application or grant program, you could actually end up paying $0 towards our bachelor's or master's programs. I would highly encourage you to contact myself directly or any of our advisors in the advising team to find out more information of this, as I want to make sure that, the zero out of pocket is not misunderstood, but also I want to make sure that all of you on attending today's webinar do take advantage of this, because it is truly an amazing opportunity where you could be ending up enrolling in, for example, a master's in business administration and healthcare services with paying $0 for it. So please do, reach out for any questions or ambiguity around this. Jeffrey, if you could please go to the next slide for me. Thank you so much. So through the scholarship, as Jeffrey mentioned earlier, we want to provide everyone with the opportunity to study in a world-class program developed in partnership with, top-tier academic institutions. The scholarship is for all people because we acknowledge and we truly want to emphasize and put value that healthcare takes care of all people. We want to put people front and center, and we want to give you guys the ability to give yourself access to a great education and an opportunity to advance in your career, to help basically increase diversity, increase equity and inclusion within the healthcare workforce and the communities that you serve, regardless of your ethnic background, regardless of your gender, culture, geography, location, demographic, and so forth. So we would like to make sure that the scholarship opportunity is made available to all, and it gives you an opportunity to really feel that you're taking the next step towards your career, towards your education advancement and development. With regards to the scholarship process, as I mentioned earlier, it is open to all, and the process is quite straightforward. As Jeffrey will help us move on to the next slide, you will see that the process is straightforward, where you start with an application to the scholarship, because we would like to hear a little bit about you first, where you identify your interest for any of the programs that are under this portfolio. And then we will work with you on one-on-one basis to guide you through the process to apply to the program and so forth. So to apply to the scholarship, we will share with you at the end of this webinar a link on where the application page is. we would like you to fill in your personal contact, personal information, employer, and then at the very end of the application page, you will notice that we ask you to share a story. This is where we would like to hear a little bit about yourself. What got you interested in entering this profession? What makes you so passionate about healthcare? What is your commitment, your involvement in the community and in the workforce overall? What are your plans next? Where do you want to take your career next? How do you want to advance? And how can we help you through this program that you're applying? How can we help you, take that sort of step? So please take your time to write this. We do sit down and truly read every single letter, every single word that you put on the essay. And that's not just because we have to, but also because we take great joy in hearing where you guys are coming from and why, you're applying for the scholarship. So, and reading your stories sometimes truly makes our day, because students come from different backgrounds, different experiences, and we're all here about, sharing those experiences so we can learn from each other and help each other grow in the space. With regards to the selection criteria, we do have a rubric in place which we could share with you individually as you're applying to the scholarship and to the program. There is a degree application process, which you will be able to start as soon as you finalize the scholarship process, but this is where we would like to work with students individually on a one-on-one basis. So I would highly encourage every single one of you to reach out to us, and our amazing advising team will be connecting with you and help you through every step of the way, through the application to the scholarship, application to the degree, or application to the university, as we've made the process quite seamless. If there are any questions, please feel free to drop them on our chat here. We will have, put some time on the side to be taking up questions at the end. And as you'll see on the next slide, basically the process, very, very straightforward. You inquire with us, we help you start your application to the scholarship, we complete that, then we move forward with the application to the program. If we feel like you can do a way better job with the scholarship, we will not say no to you. We'll come back to you and let you know, we want you to work a bit more on your letter. So, expand, let us know a bit more, and then we will review it and then move forward with the next steps. That's overall. Any further questions, please do feel free to share in the chat box. Jeffrey, back to you.
Actually, Katie and Danielle, I know want to specifically talk about why this is so important and share from their personal and professional experience.
Yeah, thank you, Jeffrey. Danielle and I are excited to be a part of this effort and this initiative to support nurses of color and also people of color, right, in general. And I was very happy about that recap and reintroduction, because seeing that there's opportunity also for people internationally, because we are a globalized society, is really a great thing. So Danielle and I are here to really make the case, right, for why this is important and how this does feed into the pathway for more diversity, for there to be more equity and inclusion, not just with people at the table making decisions, but really also in terms of how it impacts care and outcomes on, at the patient level and at the community level as well. And then you think beyond that, it's global health, right, Danielle?
Yeah, absolutely. And I think that the good work around the scholarship just provides access. I know for me, my personal story, that was kind of one of the barriers, was financial access, and also looking at the variety of the programs and how they support people where they are, working professionals that might not be able to commit to the traditional 4-year kind of education, but still making it accessible with programs associated with institutions that have rigor associated with them, high accreditation, and that would truly equip them with being successful in the variety of spaces. I also love kind of like the variety of the programming that they're looking at healthcare leadership, because as we know, the structural racism that's in place within healthcare is heavily embedded with the policies and procedures. So I love that they're making the leadership piece accessible for diverse communities, because that's where we can truly make much more of an impact when we diversify the C-suite, we diversify the managers, the leaders, those that are on the admissions committees, so that we can have a broader perspective on diverse issues, and making sure we're breaking down those structures that are in place in those particular areas. So definitely love the variety of the program, and them being targeted in making access to education more equitable.
Yeah, and diversity at the decision table also helps with the diversity of thought, right? You know, where you don't have people engaging in a lot of groupthink around issues. And it was interesting, I was looking at data from a survey that was done by another organization. And there was one verbatim, there was a question about what are your efforts towards DEI? And there was a response by a human resource manager or leader that their community is not diverse, it's predominantly white. So their workforce is predominantly white, so they don't have this issue. And I really want to caution any organization that thinks that way, because even if it's predominantly white or predominantly whatever, again, we're a very mobile, diverse society, globalized society. And you have to think about the other folks, even though they're not the majority, but who's taking care of them? And there's data that indicates a lack of diversity impacts of feelings of psychological safety, right? Not just with patients, but we're seeing that also with healthcare providers and leaders. And an example is, if you do see a situation, or you come across a situation where there is some discrimination and what have you, would you feel safe speaking up if you're the only one in the room? So that's why I really think a lot of these benefits that are listed here, enhancing problem solving, increasing engagement, which is essential for a highly productive organization, strengthening communities where you're building trust. Communities have long memories in terms of what was. So to think that what may have happened in the 60s is over and there's a wall and no one remembers that anymore, not true, right? And a lot of healthcare organizations, were built or established in that era of civil rights. Growing hiring as well, where 57% of employees want their employers to improve diversity. That is very clear. And the most important asset are the people that work for you, right? And improving patient trust. We just talked about that. That's part of psychological safety, and being able to speak up if you feel that things are not going in the right way. We're seeing a lot of that in the OB sector, right, Danielle, in terms of maternal infant health and outcomes for Black women, and how a lot of that is impacted because there's not enough diversity in that space. I know you see that with your program as well, with DOC.
Yeah, absolutely. And especially with the COVID environment, when families aren't allowed to be as present at the bedside. So really having diversified healthcare workers to infuse that trust is important now more than ever before, because that's all the patient has basically to rely on and to advocate for them are the healthcare workers. So absolutely. And our community talks about when a provider of color comes in and the patients just have a sigh of relief, like, I know that I'm going to be taken care of. And even patients actually verbalize it. So it definitely makes an impact, like you said, Katie, to foster the trust. And that's also just inherent in the literature that supports the diversifying of healthcare workers in the trust. So absolutely.
Yeah. And then the pathway to reducing health disparities, which was it's an issue that was laid bare by COVID, like it did every issue that were wicked problems before the pandemic. It health disparities and social determinants of health and all that didn't just happen. It's related to, as Danielle said, the structural and systemic barriers, right, that prevented a lot of populations from being served appropriately that were deliberately minoritized. So the key really is, and I know we have improved cultural competence, but the key is also, it's really about cultural humility, where it's commitment to lifelong learning about other cultures and the fact that you'll never know it all. So all those pieces, and this work does lead directly, it's a straight path to addressing health disparities.
Absolutely, I agree.
So
Well, thank you both.
Yeah, we're going to turn over to you. I think we beat this one up enough.
No, I don't. I think you did just like always, spoke the truth and helped everyone understand why our system needs this. And there's one thing I want to add to that, because again, in the inclusion part of this, that's so important. Is I was looking at some recent statistics, and was saddened once again that only 31% of U.S. hospitals are led by women. My healthcare career started under the leadership of a female CEO, who, Danielle, I know I've shared with you, was and is a nurse to this day. And the impact that I saw of a nurse CEO who led as if she was taking care of patients in the way she supported employees, who had compassion, yet would hold people accountable. And I always tell the story that when she dealt with employees and doctors, always doctors, oftentimes they were some of the more challenging colleagues, she would just say, "God bless them, God bless them. God bless their little souls," she would say, as she grew up in Newark, New Jersey. And she would say, "We're here to serve, and we're going to serve whether they're in my way or they're along with us for the ride. We're going to serve." And so, we've got to be thinking about bringing more women into our healthcare system. And we have got to be thinking about how we get our governing boards and trustees to recognize that we've got to have more female CEOs. It is not okay when we have female CNOs. We've got to have more leadership at all levels. And that's also what the Equity Impact Scholarship is truly about too, is that we want to diversify at all levels, not just clinicians, but also at leadership. So thank you both for covering that, because it is so, so important. I want to also highlight the issue of gender equity too. In this recent survey, 64% of women in healthcare specifically said that they believe there's gender equity. I believe that's probably a little bit high, but that's what this survey said. And we all know that that is also an area that is really, really important. And when we talk about equity, we can't not talk about that as well. And so thank you both for covering that so well and sharing with us not only your personal experience, but your professional journey too. So I want to, oops, yeah, good, okay. So I just want to highlight briefly that when Nayla talks about all the programs that are available in the next couple of slides, that recognize, as you heard earlier, that yes, they're with absolutely some of the world's best academic institutions, all not for profit, by the way, and that's intentional. We do not choose to partner with academic institutions that do not share the mission, vision, and values of equity, but also share the mission, vision, and values that a student is important and profit needs to come after, most importantly, the students. And so our value is to support these students in their careers, but also in their lives. And so what you see here on the completion side of the certificates are phenomenal quality that speaks to not only why these programs are transformational, but why these programs can be that next step to help an individual take the next step in their career and also fulfill dreams. And so 92% average completion is phenomenal for those of us that have been around academia, where you see 60%, 50%, 40%, 30%. I'm not going to sit here and say who those academic institutions are, but what's most important is that our programs with our academic partners have a 92% average completion. And what you see here is true accuracy. The degree programs also have very, very strong completion rates. We don't have that specifically in here because that would come from our academic partners. But at any time, if individuals have questions, we are transparent. We're happy to walk through that. And then briefly, this slide, and then we'll be back over to Nayla. I just want to highlight for you that, again, this proves we are not talking to just Common Spirit with this Equity Impact Scholarship Fund. And obviously the work that Dignity Health Global Education does and loves to do is to impact all learners in healthcare. And so as you see here, you see individuals at various different elements of their career in healthcare. They're not just directors, they're not just managers, they're at consulting roles, at specialist roles, but also then at leadership roles. They're nurses, they're nursing colleagues and professionals who every day impact the lives of our patients, and we must thank them. but at all different levels, these individuals have an opportunity to upskill, reskill, and be celebrated for who they are and help them develop that next step in their career through these programs. And that's what you see in these powerful testimonials.
Thank you so much, Jeffrey, for sharing those testimonials. It's, it always sort of helps, but reminds us of the impact that we have through not just DHGE through its programs, but the impacts that we could have by basically reaching out to the communities and to healthcare professionals just by extending, the opportunity that we have to education, but also through the scholarship. So since from the beginning of this webinar, we've been talking about our amazing academic partners, top tier universities, world-class programs, but who exactly are we partnered with at DHGE? The slide that we're showing you here is basically a list of our academic partners that we've built the programs that qualify for the scholarship. In total, as an organization, we have about 11 academic partners, but what we're listing here are those universities that we've actually built the programs that qualify for the scholarship, such as Duke University, for example. We've worked with a custom education wing of Duke University, which is called DHGE, and they're known there to be #1 custom executive education provider in North America. This is why we've worked with them, we've partnered with them to build certificate in healthcare leadership and a certificate in nurse leadership. We're partnered with Thunderbird School of Management, and they are ranked #1 for their masters in management globally, not just nationally in the United States. And this is why with Thunderbird, we've built, for example, our MGM program, a master's in global management in healthcare services. We're partnered with NAU, Northern Arizona University. They are ranked #3 as the best online academic institution in the United States. And with them, we've built the amazing Masters in Business Administration in Healthcare Services that I mentioned earlier as part of our zero out-of-pocket programs. We've partnered with Arizona State University, with Mercy College Plus, and American University. And on this next slide, you will see the full breakdown of what we've actually built with each and every single one of these universities. So we have a large portfolio of certificate non-credit bearing programs, which, as I mentioned earlier, are approximately 8 to 12 weeks in length. We have certificates ranging from project management, innovation, to healthcare leadership and nurse leadership. We offer certificates in the topics of marketing, healthcare analytics, and also our most famous, I would say, and newest certificates, the mini MBAs. They are certificate level, but the reason why the mini is there is because they're only 12 weeks long. They're not preparatory courses to the MBA, but they are definitely our sort of the golden programs for DHGE right now, because we've embedded some real cool concepts where we worked with world-class athletes to come into these programs and basically speak to the language of, what it takes to achieve greatness, what it takes to win, and who better than an athlete who's gone through ups and downs, successes and failures throughout, their journeys. Who better than them can speak to, being able to achieve greatness and the mindfulness. We've also had a couple of our degree programs be part of the scholarship. We have, as I mentioned earlier, the Masters in Global Management. We have a fantastic RN to BSM program with our partner, Mercy College of Health Sciences out of Iowa, and the MBA in Healthcare with NAU. Anybody that's interested in applying to these programs, the process was explained earlier. It's quite straightforward. You'll be starting with a scholarship application. And then as we are working through your scholarship application, your letter of intent, once we determine which program you're interested in, you will be connected to one of our advisors who will then guide you next to start the application to the program, whether that's the degree or the certificate. On the section, the basically back-end section of the slide, you will notice a breakdown of fees. The reason why they're strike through and you will notice new price is because we want to show to you guys the significant amount or the significant difference that the scholarship is making in terms of the cost of this program. For some certificate programs, the scholarship is taking care of approximately 75% of the overall cost. So you're really walking away with a certificate in healthcare leadership with one of the top universities in the United States, such as Duke University, for only $500 when you do apply and qualify for the scholarship. The scholarship also allows you to obtain your MBA in healthcare as zero out of pocket. The original cost of the MBA with NAU is approximately $20,000, but we've allocated funds of the scholarship program that would allow you to receive a scholarship of up to $9,500. You receive some sort of support or tuition reimbursement from your current employer, some sort of support or grant through the government available programs that could be in your territory, and you could honestly walk away with not paying anything for this MBA. And we've seen it. We've seen it with our current applicants. We've seen it with the students that have come through the application process. It has happened. So any questions that you have with this regard, please, feel free to submit it in the chat box. Contact myself directly, or our advising team would be more than happy to walk you through that process. We would also love to share with you some sort of testimonials or feedback from the scholarship recipients when we've announced to them that they've qualified for a scholarship and they've been basically chosen to study with us. One of my most favorite, and not because I'm a new mom, but also because it really sort of resonates with us. And as Jeffrey was speaking to it earlier, the mission and the vision that we have towards this, the impact that it is making. And for example, Georgine here in the middle, what she sent to us back was, as a single mother of two, my life changed when my second child was born with SED, a rare genetic blood disorder that primarily affects those of African descent. I was determined to learn everything I could about the disease. I realized the disparities in healthcare and health outcomes and the lack of funding and research. I believe that the scholarship will serve me in my role as a nonprofit executive advocating for those with SED and other rare diseases. Or Talerita here at the end, basically she's coming from a minority background, and she said, I accept my responsibility to gain the necessary knowledge to make system level changes, including within the healthcare administration system. What I have learned is that to make meaningful change in healthcare administration, I have to have the language and tools for this field. This scholarship will provide me with the tools that I need to make organizational and healthcare systems changes. These testimonials, guys, did not come to us because we asked for them. These are actually part of the students' essays when they applied for the scholarship. So this is exactly what, the kind of feedback that we would love to hear from you. Tell us, why you got into healthcare. What inspires you to wake up every morning, to go to work, feeling positive, feeling energetic to make a change, to drive a change, and also what got you to apply for this scholarship and what you're looking to do next. We have some amazing feedback, and I think I could probably go on, not just for the entire duration of this webinar, but I could go on all day giving you, some of these essays that we receive from the students. For example, Matthew here in the middle, he said, I grew up in a small town about an hour south of Pittsburgh, Pennsylvania. As half Filipino and Italian, we did not fit in. This experience helped shape my compassion towards others who were different. This scholarship would help better position me as a thought leader and innovator in my workplace. We must become more innovative and inclusive to encourage and advocate for a more diverse and equitable healthcare workforce. And he couldn't have said it any better, right? Like, if we want to see that change, then that change has to start with us.
Okay. I just want to ask our panelists if you have any additional closing thoughts before we check and see if we have questions.
No, the only thing I'll add is, what's not to like? The main barrier in terms of access, and Danielle mentioned it earlier, and I remember experiencing the same thing, is access to funding, right? And being able to afford these types of programs. So this is a gift, and I encourage everyone, nurse or not, to take advantage of this opportunity. Our role at this point is to deplete these funds. That's what we want to do. So be replenished for the next batch of folks to come through, right? Right, Danielle?
Absolutely. I definitely echo those sentiments. And it's fairly straightforward process, so there's no excuse. So yeah, definitely apply, take advantage.
Great. We want to remind those of you that are with us, feel free to put any questions you have in the chat box. We're happy to answer them now. I did put Naila's email address in there. She's happy to walk through one by one any questions as well. But we do want to give you an opportunity. So I'm sure you're tired of hearing from me. So we'd prefer to hear from you. If there's anything you would want us to answer, don't hesitate, particularly. Yep, so good, very good question. I'm gonna, Linda, thank you for your awesome question. And I will put a link in here where you can, without question, apply. The essay, as Naila mentioned earlier, is when you go on to this link, it's going to be an application, and then it's going to be actually right where you also would put your personal statement. So everything goes right in one place, and it's where you have an opportunity to apply, include your personal statement, and then hit submit. And then, as Naila referenced, the scholarship committee is going to review it based on the rubric. And so it's important that you look specifically at what you what you're going to submit and make sure it fits that. So absolutely, Linda, we will get that for you.
Jeffrey, before we move on to the next question, I just want to, if you could just expand a bit on the essay itself, because I think that could be an issue for some folks in terms of trying to make it perfect, getting someone to wordsmith it, getting an editor. Like, you know, because it sounds like you are willing to help people work through, right? Because
Absolutely.
It's hard to write, right? That's the issue for a lot of folks.
Katie, let me just say, so the equity and education component is really important here. So let me just say that what you will find, and Naila will tell you this, that we have now, just a few weeks ago, received over 500 applications. Now, again, not everybody does get a scholarship. And frankly, when an individual doesn't get a scholarship, it's because they didn't do anything with the personal statement, or you know, they're not able to, in the end, afford it even after the scholarship. And even in those cases, we do our very best to see how we can make it work. However, as it relates to the personal statement, here's my advice that I give every individual that reaches out to me. This is your story. You know, this is not about an English paper. And so, you know, people talk about this all the time. As someone that teaches at a graduate level and has the privilege of teaching nurse practitioner students in an ethics course. So again, I'm not teaching them clinically, so don't get worried, Danielle and Katie, because you wouldn't want that. I always tell everyone that nurses don't write the way people think, you know, in the way that people may think. And so when I approach this, I always tell individuals, this is your story. You tell us your personal statement. You tell us why diversity, equity, inclusion is important. And do not stress over, frankly, in my opinion, and Naila can correct me, but I encourage everyone, don't stress over grammar. Don't stress over those types of things. What is most important is your story and how you're going to advance diversity, equity, inclusion through equity and in education. That to me, but Naila, you comment as well, because I know you worked with this and done a phenomenal job.
Absolutely, Jeffrey. No, it's very true. We don't want you guys to stress over the word limit, the fact, oh, they asked for a minimum of 800, I'm only at 780, you know, what do I need to add next? Forget about the word limit, forget about, you know, what we've asked you in terms of the questions. Those questions are there to guide you, to, you know, help you sort of trigger, you know, to sit down and write that letter. It's not about to, you know, sort of set parameters that you guys have to answer these questions and not, you know, share the story with us. We want to hear from you. You know, tell us about your experiences, tell us about what got you, you know, to be interested in, for example, taking a program next in your education. I'm reading essays every day as we receive applications from students. And what I can tell you for sure is that 2 essays are not the same. So clearly everybody's receiving the same requirements, the same set of rules, and yet I do not see 2 essays to be of the same format. So sit down and, you know, start writing as if, you know, you're talking to Jeffrey and I and just telling us, you know, why you are in this and what you want to do next with your career. We shared with you some examples, not because we want you to go, you know, by those examples and sort of, you know, be like that. Absolutely not. We want to read about you. Thank you, Christina.
I saw a good question in here, I believe from Christina. Are these scholarships only for RNs? And no, these scholarships are for anyone in healthcare. As well as an individual that's not in healthcare but wants to come into healthcare, because we know that there are a lot of hoops sometimes to get into healthcare. Now, recognize that the RN to BSN, yes, you would have to be an RN, but for anything else, there is nothing that would limit you from any of these programs. And so I tell individuals, this is an awesome opportunity to aspire and literally have no one in your way to do so. And let me just say this, because I get this question all the time. And, there are circumstances where we know, and I will tell you that we've seen personal statements our scholarship committee has shared with us, where even the amount of the scholarship may get challenging for them, but they have an awesome opportunity if they get this education. Reach out to us. We do not want you to not take an opportunity like this on just because of some barrier. Reach out to us, because this was done purposely to bring more diversity, equity, and inclusion. And if there's some type of a barrier that still exists, we're going to do what we can to see how we can help. And so I want to encourage that as well. I saw there was another question, I believe, how soon do you hear back? So the scholarship committee gets a lot of applications, as you heard me talk about, but they do their very best to get back to students somewhere in the 48 to 72 hour window. There may be times over the weekend, for example, there's going to be a delay, as well as, if they're coming on a Monday, they may have gotten a ton of applications over the weekend or throughout, but traditionally 48 to 72 hours. If it would go beyond that, I also encourage students, there's an email always on there, as you saw, just reach out. It doesn't hurt, if you want to check on something. The team wants to be, responsive and helpful at all times. And it looks like that concludes the questions. Christina and Linda, congratulations. We're happy to hear you're interested. I know the scholarship committee is going to look forward to your application. If you have questions, again, as you work on your application, don't hesitate to reach out. Nayla's email is in the chat box. The link to apply is also in the chat box. I want to thank all of you, particularly that attended, for what you do in healthcare today and for what you will do in healthcare tomorrow. I also, must take this moment to thank our panelists. Both Katie and Danielle, as I mentioned earlier, are true change agents. But as you heard them talk today, they're also authentic, genuine leaders who care deeply about each and every one that they serve. And we're privileged not only to have them as partners here, but to know that there are individuals like them that care so deeply about improving our healthcare system. And you heard them share that authentically, and why diversity, equity, and inclusion is more important than ever. And if we are to improve patient safety, if we are to improve patient outcomes, it will come through these types of efforts and initiatives. And so Danielle and Katie, not only thank you for being with us, but thank you for what you do each and every day to influence positively our healthcare system, and most importantly, to change lives, because that's what both of you do. And also, Nayla, thank you for what you do and for taking the time to share the details of the scholarship. I know you do it both personally, but I also know you're personally committed to what this means. So thank you all so much for joining us. At any time, if you have questions, we are here to serve. I can't thank our panelists enough, and everyone have a wonderful evening, and let's work together to advance equity in our healthcare system. Thank you all.
Thank you all.